Hello and welcome. This is Amanda Howell with Iatrix Systems, and I will be your moderator today. We do encourage you to participate in today's webinar by submitting any questions or comments in the questions section of your control panel. Please feel free to enter your questions at any time during the webinar. As an FYI, we are recording today's webinar. And finally, after the webinar, you'll have the opportunity to fill out a short survey to help us continually improve. The survey will appear when you leave the webinar, and for your time, your name will be entered in a drawing to win a $100 Amazon gift card. And all of these drawings are held at the end of each month. Our speaker today is Michelle Schneider. Michelle is a product director with Iatrix Systems, focusing on the privacy needs of hospitals, specifically with partner risk management. She has seen firsthand the challenges with managing partner relationships, safely and effectively. As a registered nurse committed to the mission of educating the healthcare community about the importance and best practices of safeguarding PHI. With that, Michelle, I'll turn it over to you.
Okay, great. Thank you, Amanda, and welcome everyone. I just want to say thank you in advance for your time. Very excited to chat with you today about partners and PHI and working with you to talk about how you can better understand your risk. Now, just so you know, today is an education session. It's actually an encore of the presentation that I gave at Muse this year. And so when we do our education sessions, we really work to make them strictly educational and not a sales presentation. I do want to mention, though, that we do have solutions to help you meet these challenges, and at the end of the session, I'll let you know when there are webcasts that are demonstrations of our products, but today we'll concentrate on strictly education. So hopefully that is not a surprise and meets everyone's needs for today, and you can just contact me after if you were expecting something different. I have posted our agenda here. We're going to talk about healthcare breaches, regulatory requirements, managing your business associate agreements, talking about your liability as a healthcare institution, and also enforcement of the rules. And then we'll get into some questions and answers. I don't have a lot of question and answer time in an education session that I put in there, but I will stop a few times along the way. Please do take advantage of that chat section. I would be happy to answer your questions or even open it up to the group. There are certainly things that I haven't come across and would be happy to hear from and learn from all of you. So don't hesitate. That was one nice thing, that when you're at Muse and it's all live, face-to-face, it's really nice to get that interaction going. So hopefully you'll feel comfortable entering information in that chat section. And again, I just would love to learn from all of you as well. So just to kind of warm us up, I like the Ponemon Institute's report that they've done the last couple of years, and I've learned a lot from those. They've reached out and surveyed 625 individuals for these results. And one of the things I thought I would start with is their question around, has your organization experienced a data breach or cyber attack caused by a third party? So these are the yes responses. So we can see that in 2016, data breach caused by a third party, 49%, went up 7% in 2017. That's not a huge number maybe when you're looking at it this way, but really we should be seeing a decline is what I'm thinking. We're getting more educated, the tools are getting better out there, and I'm feeling, I was a little surprised to see an upswing, and then data breaches caused by a cyber attack against one of the third parties. So the third parties, their methods, their procedures for securing their information and their data was attacked. And that affects you as the covered entity. And that's what the hospital is referred to in all of the legal language and in the HIPAA omnibus rule as the covered entity. So we're going to talk a little bit more about that. But the cyber attack against those third parties went from 34% to 42%. So we're going to talk about those hacking incidents. The hackers are really, they are brazen, aren't they? And so we're going to talk a little bit about that. And the regulatory requirements that we're all trying to work within and to meet are related to the HIPAA Omnibus Final Rule. And that's been around for quite some time. And you as covered entities must maintain a business associate agreement with all of your third parties who, and this is a little bit funny because it says who will interact with protected health information. And they talk about specifically, it's really only for people who are accessing that. But there have been some breaches that relate to a somebody who wouldn't be expected to, but they saw something on a desk or they saw something somewhere and they shared that and a breach occurred. So most of the people we're working with have a business associate agreement with everybody because there could be incidental exposure to PHI. So you're sort of protected in the language here, but if a breach happens as the covered entity, you still would be responsible. So all business associates who will interact with PHI should be evaluated for risk. So this is really two different things. The business associate agreement is talking to you about just that, the agreement that you both sign, you look at, you toil over, work with the language, sign it. But as part of that, evaluating the risk, deciding, making a conscious decision, yes, maybe they have this going on, maybe they do store some of our data, maybe they do have an offshore person doing some work. These are risks that you need to understand, know about, and make a conscious decision. Yes, we're going to move forward and work with this third party. So knowing that, you might change your practices, where a lot of people have a business associate agreement and they're like, it's there, I'm never going back to it again. You might say, you know what, for these guys, we should do a recheck in 6 months. Or maybe we want an annual review. A lot of people moving to that method now. So what's a business associate? So in the HHS definition, it's really any person or organization that isn't one of your staff members, right? They're not an employee of yours, who they function on behalf of you. So they're providing you a service. And this is where it says that involve the use or disclosure of individually identifiable health information. And this is what I was just talking about, where we get into those situations where you've got, where really the incidental exposure can happen. It can happen with a maintenance person who's working on, plumbing or something in an area where there's a mobile documentation device, and they happen to see something. They overhear something, whatever it is. You want to make sure that they have made a promise and they are responsible for saying, we will not share any of that information, so that you can show you did everything that you could to make sure that they were not going to share sensitive information. So I think that I'm seeing a shift with the people we work with, that they, they're not going to stop and draw that line anywhere. If you have a contract with our hospital, with our healthcare system, we're going to have a business associate agreement. Okay, so now just a third-party inventory is something that's becoming more and more important. So do you know who your third parties are? Do you have that aggregated somewhere, easily accessible? Do you know who the riskiest ones are? That inventory is really bubbling up as a priority for healthcare entities, for our covered entities, to say, yes, I know who they are. Yes, I know who's in my system, when they're in my system, why they're in my system. You need to know that and be aware. So taking that extra time, a problem is just too expensive, not just money-wise, in credibility and reputation. And, our goal as a covered entity, as a hospital, a healthcare institution, is to take the best care of patients that we can. So in this case, does your company have a comprehensive inventory of all the third parties with whom it shares sensitive and confidential information? Not very many did. I would expect more. There are tools out there now. IATRIC does have them, but we have competitors out there. There are solutions out there that are available for everyone in all different price ranges, so that you should be able to pull that together. So 60% in 2016, now 57% only have that information available. So that's a big deal. And I mean, we're talking about thousands of people. So in 21% of respondents in one of the researched areas said they had over 1,000 vendors that they work with. So that's like herding cats, right? Like trying to keep all of those together. You need a very organized way of doing that. So the regulatory requirements include that a business with a business associate contract, that you have to include certain protections for the information. So there's got to be the agreement, not just the agreement, but in the contract, you have to have written safeguards on that identifiable information, whether or not it's used or disclosed by those business associates. How is that happening? Do you understand that? And making sure that you're clear on how it will be used and where it will be stored. So I don't know if all of you have heard of the wall of shame, but you don't want to be there. You don't want your name here. And we may have some people in our session today, and I want to make sure that this could happen to absolutely any of us. These hackers they are brazen, they do not care, they are really persistent, and they keep finding ways around our safeguards. So it's not just hackers, but it's also our third parties. That's not a brazen or purposeful offense, but it's never on purpose. And in most cases, it's accidental. It's, oh my gosh, I didn't mean that. Oh my gosh, I took that device home because I was going to do work and now it was stolen. Something like that. It's not usually a purposeful attack. So if I have shown your entity's name or talked about something you're close to with some of these breaches, it is not to exploit that. It's simply to educate your peers and all of us to say it can happen to anyone and we need to be careful. And the HHS is being very strict. So in this particular example, behind that foreground picture in the background is what the wall of shame looks like. And the ONC is the one that publishes this and keeps it up to date. And it has actually a pretty advanced filter where you can sort and select on what types of breaches, who it was, what year it was, how many records were affected. And if you link to that, you can see what the fines were for that. So everything is public, everything is posted, and anything I'm sharing here is public anyway. So in this case, a third-party vendor stored data files on a commercial cloud server without adequate security. So in this case, the covered entity was responsible. They hired someone to store this information, and they did have it on a cloud-hosted server that didn't meet those requirements. So even with a BAA in place, it's up to you to make sure that the practices being used by the business associate meet the requirements of HIPAA, meet the requirements set forth by that HIPAA omnibus rule. So going through that, understanding that is very important. And it's a really big burden on all of you and on the covered entity for sure. But that is where the buck stops. And so making sure that your business associates, those agreements are well vetted before you get into it is very important. So if you do not have a business associate agreement, that is up for a fine as well. So in this case, it was $31,000. And in this case, it was simply that there was no BAA in place. So we have had people over the years who, they're very excited. They get the contract for one of our applications and they're getting us, they connect us with the network administrator and the IT people, and they're like, okay, we're going to get you guys in there. We're so excited. And you go in and find out that the agreements have not been signed. And that stops everything because that's too important. But in many cases, it just happens, and people think like the compliance team and the IT team need to talk. They need to understand that nobody gets access until the compliance team says, yes, that BAA is in place, signed by both parties, we're good to go. So that needs to happen. Everybody needs to, that protects everybody. It really does. And you need to make sure that that's in place, and don't let your excitement and your eagerness to hit a date to implement something quickly because, you know, you need it. We've wanted this for 2 years. We've been trying to get this. You've got to cross those T's and dot the I's, right? So in this case, the required disclosures, if there is a breach, if something does go wrong, that detail must be exposed to individuals when they request access to or an accounting of disclosures of their protected health information. So if they ask for it, they can receive it. Absolutely no questions asked. And the HHS, when it's doing a compliance investigation or review, or it's part of an enforcement action, you must turn over the information related to that. So in some cases, people wanted to know, hey, if I'm getting into a contract and it's not really a business associate agreement per se, like you post on HHS as an example, it's kind of a self-certified type of a thing by the third party to say, hey, yeah, we're compliant. That is not okay. The covered entity is required to enter into a contract or other written agreement with the business associate that meets the requirements outlined in the HIPAA omnibus rule. So it's not going to work to just have a generic agreement out there. So a lot of people feel that once that BAA is in place, it's time to relax. And the paperwork is part of it. But let's be real, there are a lot of mean geniuses out there, right? We've got people who are constantly looking to take advantage of maybe a loosey-goosey type of agreement or setup where they can exploit any vulnerability. So it's important to be on the lookout and to revisit these BAAs. Make sure, I mean, it's easy to check a box and say, yeah, we do that, yeah, we do that, yeah, we do that. Make sure it's happening. Revisit those and confirm that indeed the third party is not pulling any information, not taking things. We're talking screenshots, we're talking reports. They shouldn't be pulling that onto their system if they said they weren't going to. Okay, you need to make sure, and if they are, you need to make sure that indeed that is in a protected, encrypted environment. So as I said, no one is exempt from this. This is not a ha-ha pointing something out. This is saying this could be any of us. And we had a report of a site that had a hacker that used a vendor's username and password. And that's how they got in. And then they were, their data was held for ransom. They had to pay in Bitcoin to some far off, account somewhere. So that is something you want to make sure that your third parties are taking measures to make sure that those credentials are being well secured and cared for. The big companies as well. It's not just about the community hospitals. We've got the Equifax breach, which was absolutely huge. LabCorp, more recently in the last 2 weeks, had a very large breach. And it's not just our healthcare industry. We're talking Sony, we're talking, the banking industry, we're talking everybody. It affects so many of them, and these are really large companies with big teams of people who are trying to manage this data. So it is not an easy problem to prevent. So in the Equifax situation, data sharing with third parties, they noted, was seen as one of the biggest vulnerabilities among healthcare providers and insurers, with 63% of respondents mentioning it as a key vulnerability. So it doesn't mean you don't do that. And what we're seeing is a real swing in the reliance on third parties, because hospitals are they need to rely on them. The expertise doesn't always exist in the hospital to meet the requirements of the technology requirements that all of the latest and greatest requires. So it's important to be able to bring in those third parties, to trust them, but to hold them accountable and make sure that they are accessing your system, your data, in a way that you're comfortable. Okay, now before I go further, I've been talking for a while here. I do want to make sure there's no questions. Let me just take a moment here to let Amanda give me an update. Have there been any questions, Amanda?
No, not at this time, Michelle, but I do want to remind everyone that you can enter your questions in the questions pane at any time during the webinar.
Okay, great. I'll stop again in a little while. I get on a roll. So if you do have a question, just enter it in there and I'll be happy to answer that. And it doesn't have to be a question. It can be a comment or something interesting, or, hey, we've been doing this to help with this problem. Love to hear about it. So don't hesitate. Okay. So now I say it's time to fight back, right? We've been talking a little bit of doom and gloom. This can get a little depressing to hear about all of these evil people out there who are trying to hurt us, or just the overwhelming task of managing third parties. And it is overwhelming, but we have tools that you can use, and just safety procedures, just things that you need to do every time. So you need to understand the document you have your vendor sign. A lot of them are very large. We get some of those, and boy, they're big. And you go through, lots of questions, over 100 in some cases. And I try to share with everybody, get input from everybody before I'm working on a project that requires that. And it's a daunting task, and you try your best to fill all that out. So try to be concise with those questions, clear about what they are. There are examples out there. If you're part of HIMSS, I know there's examples out in their education. HHS, of course, has an example that they recommend, and then you can simply modify it to meet your needs. So if there are some things that are, uber important to your group, then feel free to include those. And then really look at those answers. You put those questions there on purpose for a reason, maybe because of an issue you had or something you heard about, and you're like, that is not going to be me. I'm not going to be in that news story next week, and you're determined. So really look at those. Reviewing the responses will help you to understand the risk. And sometimes the risk is worth it. You're like, okay, I understand that happened to them, or I understand this, but they've mitigated that risk doing X, Y, and Z. What action did they take? It doesn't mean you don't work with them. It just means you understand your risk. And as I said earlier, maybe increase how often you're revisiting that BAA. How's it going? Have we had any concerns? So make sure that vendor has privacy policies. Look at them. Ask them to share those. They're used to it. We are getting asked those questions. We are getting asked for that collateral, and it should be very easy for them to go, oh, here it is, boom, and send it off. So are the employees of that third party trained annually on safe handling of PHI? So asking them that. Do they have a privacy officer? I don't have that listed here, but I know that's an important one for a lot of the people that I work with. Do they store PHI in their system? So in a lot of cases, it's not necessary. They go to your system, they do everything there. In some cases, perhaps they're performing analytics, perhaps they're doing some predictive work, and they need to pull it into their system and do what they need to do, and then provide you with the results. Understand if it's leaving your system, and then say, hey, what about that server where it resides? I want to know about it. How are you securing it? Is my patient's data accessible to anyone? Is that encrypted? So will they destroy the PHI? This is very important. So say you're with that company for 15 years, and then you say, we're going to go another way. Make sure there's a plan for what happens to that data when you terminate the contract, the agreement. Do they keep it in their system? Are they going to destroy it? Are they going to delete it, reformat the drive? You should know that answer. So just because they meet the minimum doesn't mean you let your guard down. So even if they really appear to have no risk, they meet your minimum requirements, again, I'm seeing that real switch, the swing of the pendulum toward annual reviews of BAAs, revisiting those. We had a meeting a couple weeks ago, and one of the CIOs I was talking to said that they actually, anytime they are asking for a change, a user asks for a change in access. So maybe I just had a certain menu and now I'm looking for really everything, administrator rights. Well, now they're like, let me revisit and make sure I'm comfortable with that. Why do you need it? Let's look at your agreement. Taking the time to review that and saying, okay, that's covered here. I understand why you need it, and moving forward. Taking a little time to do that is so worth it, okay? So the types of interactions that you might want to just figure out in that agreement is the person on site working in your system with access to PHI. That's probably the safest, right? They walk into your building physically accessing their PHI. You've got a little bit more control over that. You can see them in your facility. The remote users signing in via VPN, LAN to LAN, do they have separate logins for each user? When do they sign in? Why do they sign in, and for how long? So are they signing in at 2 in the morning, 3 in the morning? Really, is there a need for that? Ask the question. Understand when they're in there. Maybe have a procedure, a workflow of seeing that type of activity and how often these people are in the system and at what times. You know, does that make sense? We have had report writers who would work at that hour. So there are certainly times when it makes sense, but ask the question. Make sure it's for a real, true reason. So where are they signing in is also very important, right? Are they in a coffee shop? Are they, using a secure network to log in? So are they on a mountaintop, on a bus where someone can look over their shoulder? Just understanding the geography of where the person is when they're logging in and accessing PHI. And have they taken precautions to ensure security? Do they have an antivirus solution on their devices? So that's fine. They have a laptop. They're on the go. That's just the nature of their business. But have they loaded that laptop with the precautionary tools, antivirus, firewall, encryption, and do you have multi-factor authentication in place, or do they, so that before perhaps the vendor is managing that from their perspective, that's what we do. So we all log in with multi-factor and then we access your system. So we handle that, but you want to ask that question. Make sure that you are secure, because the liability is a big deal. So who's accessing your system is, as we've talked about, with the enforcement, with the way that the government is going to look at that when they do a review, that covered entity, and that's you, that's who's responsible. So it's your job to know. And the challenges of that is, making sure that your third-party vendors live up to the promises in that BAA. Check, check, check. Sure, let's make sure a year from now, things change, 2 years from now, the leadership changes, whatever changes, you want to keep up with it. Make sure that they're still true to that. Making sure access and data extraction is purposeful and with permission. Talked about that a little bit, that pulling that data out of your system, where are they pulling it to? And is it necessary, and do you know about it? 63% of resources cited 63% of the sources of information cited resources as a reason for not performing these evaluations. As we're going to get into in a couple of minutes, it doesn't seem like you can afford not to do it. So if resources is the issue, there is plenty of data out here to take to your leadership and say, one breach, one issue, one problem with a business associate is way more expensive than a resource to manage the process of protecting us. So, it's something to consider. If you feel that resources is the reason, there's plenty of proof out here to say it's worth your time and the money. So a couple of things. I mean, there is tons of data. It is all so easy to find. If you just put in 2018 healthcare breaches fines, just throw those words in a search, you will be busy for a couple weeks trying to review it all. Some of the top ones that I took out because I thought that they were more pertinent to business associates. A lot of these breaches are about remote logging in, things like that, which also is an issue, of course, with third parties, but not specifically with business associate agreements and things like that. So it's really a double-edged sword here. We've got the agreement side, we've got the remote login side, and really we need to wrap our arms around both those things. So for Fresenius, they did not follow the risk assessment and risk management rules. And they had a $3.5 million fine. It was a huge fine. And so that was really, really crazy, affected many records. CardioNet had a disclosure of unsecured EPHI by a third party, $2.5 million. Women and Infants Hospital, third party removed unencrypted backups from the data center. So they were taking them to another location. They were on the cassettes and they were not encrypted. So unsafe practices, the covered entity is responsible. How are you going to keep my data safe when you remove it from my physical location? That we need to ask those questions, and we need to make sure that we like the answers and are comfortable with those. That was a $400,000 fine. Catholic Health Services had a theft of a third party's mobile device. Again, the mobile device, how is the data protected? It was not in this case. There's plenty of information to back those up, and these are from the HHS website. So at the end of this, what I'll do is I'll show you there's that website. It's just all out there, so it's available to everyone. And the HHS did say in an interview, business associates must implement the protections of the HIPAA security rule for the electronic protected health information they create, receive, maintain, or transmit from covered entities. And that I thought was very telling right there. That's it. That's it in a nutshell. And I thought that was a perfect summary of trying to discuss the enforcement of this and what they use as their bar to judge something by. So I'm going to go ahead and open up again, see if there are any questions that have come up. Please go ahead and type those in the chat. And again, any comments, anything like that is welcome.
Okay. All right, Michelle, we do have a question here in the questions pane. For local government entities, as we get a lot of pushback from our BAs when we ask them for security or privacy policies. I understand they have concerns about business proprietary documents that may become open to public records requests once in the local government domain. How far do we push for those policies?
Well, I'll tell you, that is a tricky question, and I don't think I'm going to have a great answer for you. And we, as a third party, have done that. We have responded to RFPs for government HIEs. Okay, so we had to disclose information, but we filed a I'm sorry, the name is escaping me and it's easy, but we had to file extra paperwork as part of that to say this is our IP and we feel that it would threaten our, our competitive edge if we were to share that. And so we had to apply for that, but on the local government, I don't know that there's always a way to do that. I think that we need to have both sides allowing for us to share in a way that just says the server I'm storing your information on, this is what we use to encrypt it. I don't think we should be forced to say how we get it there, what we do, as long as the transmission is encrypted and the storage is encrypted and meets the requirements. There has to be a way for us to do that. And I'm sorry, I know this isn't a great answer, but we have suffered with it as well. And I think in some cases it has prevented us from winning some work because we're not willing to take the risk of providing it. And that really is a challenge for the third party and for you, because you want that solution. You like it, you would like to see it in your system. So I don't have a great answer. I can just commiserate and say that yes, it is a challenge. If anybody has an example of something they've done, wording they've used that could help the group today, we'd love to see it and share it, because we have not found an excellent solution. Some people have been willing to work with us to make sure we could submit our RFP, and not have to overindulge. So I hope that's a good enough answer. And if you have a follow-up question or response to that, don't hesitate to put that in the chat. Amanda, anything else?
The same attendee that asked the question put in the questions pane. We have used attestations in the past.
Okay. And we have done that, and I think that's the word I was trying to find, so thank you. So using an attestation to say that, you basically have to promise without giving away your information that you are taking ownership of a particular way of storing or caring for information. And some people will accept that and some won't. And we've been in that, as I said, in that situation as well. So thank you for that question. It's a really interesting topic. I don't think I have solved it, but the conversation is an interesting one, certainly, and I don't think it's an easy answer. So some of the challenges we already just talked about. Oh, go ahead, Amanda. I'm sorry. I didn't think there was another.
There's not, Michelle. I just was going to say there's not any more questions. You go right ahead.
Okay. Thank you so much. Okay, so some of our challenges, the risk assessment. So I talked about that a little bit, and really deciding what risk you're willing to bear is difficult. Piecing that together, there are some examples out there. We've done a lot of work at IATRIC with our customers to do that, and I know other companies have as well. It's a tricky thing to try and decide how much risk you're willing to take, but we need to jump in at some point, right? And we need to also, we got into a pretty deep conversation with a group about the fact that you vet your third parties, and at some point you just have to go all in and say, we're partners. We're going to partner in this, and you're not going to have that 100%. I am no risk at all ever. So you go down the road together, and at some point it just has to come down to the relationship that you have built with this partner. The documentation requirements. This is also difficult, not the actual documentation necessarily, although forming the questions in a way you're comfortable with is a process. But once you get there, it's done. And then you have to maintain those for 6 years in order to meet the OCR audit requirements. And, you can house the agreement with some of the traditional systems, but storing and associating a risk assessment with that agreement can be difficult. So trying to pull all of that together can be a challenge. Resources we've talked about a little bit, and the workflow, trying to get back to those things. Did I get back to it in 6 months? And awareness. I actually have started to see more information about the board of directors, for instance. They are often only hearing about issues. They don't ask for, I don't know if it's because of a lack of awareness or because they kind of want to be separate from this discussion, because it is, once you're in and then you're all in, but they don't usually get updates about risk, about business associates, and they haven't necessarily been asking as a rule at most healthcare institutions. So getting them to understand that this is important, that they need to understand that protecting the healthcare institution from, you know, the risk that third parties might bring in is important, and it's worth investing in. And let's get a report at every meeting. Let's find out how it's going. Have we had any breaches? How many, you know, maybe you've added on 100 new vendors this month. Well, they should kind of understand that it does get to be in the thousands, and that's huge. That's a lot of management. And for poor visibility into third party and nth party relationships. So sometimes you're using a vendor who's subcontracting to other people. Now that risk has just kind of expanded, right? So in your business associate agreement, you want to say, do you subcontract any of my work? And I want to hear about that. And who do you use? And how often do you use them? And why do you use them? And also the fact that there's no centralized control over third-party relationships at many of the sites that we work with. It's like, oh, these guys handle their contracts, those guys handle theirs, and, you know, trying to pull that in to one centralized group is going to give you a little bit more control over that process. So I'm going to get into some examples of violations and talk about how we can mitigate the risk. And again, this is not to embarrass, but I think we all need to understand the types of things that are happening and what can you do to prevent something like this. So in this case, the third-party server that hosts the electronic health records of this clinic were hacked by someone, and it exposed the protected health information. And the data was encrypted when it was in certain folders, but then there were documents that were just in. So you know how sometimes you're like, oh, I'm just going to send this to my C drive, and sometimes you've got a couple seconds and you go find the folder and you drill down, but other times you're like, I'm just going to drop it in there in the C drive and I'll put it in the folder later. Well, those files were not encrypted, the ones that were outside of folders, and so they were left vulnerable to be accessed. So certainly mitigating that, find out how that storage happens, require that all the files are encrypted, and confirm that it happens. Make sure that not just the folders are encrypted, the whole, you know, that whole drive should be encrypted so that anything in there is safe. And this affected over 14,000 patients. So in this next one, a server hack threatened over 14,000 patients. And oh, sorry, this one is a duplicate. So in this case, the risk mitigation, in addition to the previous, would be to get that risk assessment in place and make sure that you're reevaluating those files. So I'm sorry about that. That was a duplicate. In this case, the hackers breached this health system and exposed over 18,000. And I guess the thing that struck me here was that they said they're going to provide their patients new medical record numbers on request. And that was a real red flag for me. I think for any of us in healthcare, to a patient, that might seem like, oh, I want a new medical record number, that's going to be great. Well, now well, first of all, if it were on an island, that's fine, and I would be, you know, safe and starting today. All of my history would be gone, my allergies, my problems, my meds. So I don't think this solution would meet any of the other requirements that the government has for us, or meaningful use, or any of those. And also, any EMPI tool in the world is going to match your new medical record number with the old medical record number. It's going to merge you into your EMPI anyway. So I kind of felt like that was not really a fair offering to the patient to say that. And it was also a real lot of extra work for the staff who would have to provide a new medical record number to this patient. And how do you prevent the system from merging those? So to me, that was kind of a wild suggestion. So in this case, implementing multi-factor authentication, if you were to read this in more detail, it was related to stolen credentials. And, you know, when you get that second factor of authentication to your email or your phone, so many times, if you think about these hacking incidents, it would have been saved by making sure that you had multi-factor authentication in place. So again, it can happen to anyone. In this case, again, $55,000. One hospital was a victim of ransomware, and they paid that $55,000, and they logged in with a vendor's username and password. Multi-factor authentication would have helped there. In this case, a hacker infected physician devices with malware, and performing those device checks and allowing, before allowing any of that remote user access to the network would be helpful. Are they using antivirus, encryption, firewall, all of that, making sure that the device meets your minimum requirements before anybody even has access to your system. So in this case, the hospital was fined $41,000 for allowing a vendor to access the hospital system without having the required BAA in place. So simply for not having that BAA. So we need a way before the vendor gets into the system to say, hey, that's all fine and good, but there's no BAA. Have it check against the system. If you can automate your agreement management, you will be able to notify your IT department and restrict access by that vendor if the agreement is not in place and ready to go. So those are some things that we can do to help mitigate our risk, prevent some of these really bad situations. And again, really thinking about the resources it takes versus and again, it's not just about money. It costs us so much in credibility, in time, and in our reputation with our patients, their trust. So I'd like to open it up for questions. That's the end of our session. And I would love to hear from you. And again, it doesn't have to be questions. Any comments or anything that you'd like to share would be great.
Okay, just a reminder to everyone, enter those questions in the questions pane, and I'll be glad to read them out. So far, Michelle, we don't have any, but we can give them a little bit of time to type.
Sure. While you're typing, and please feel free, I'll let you know. So at the beginning, I let you know this was an education session. And the reason we are educating you about this is because we're passionate about it. And we do have solutions to help you to manage your agreements and risk assessments, risk scores, making sure your partners are well vetted and that you have a way to manage them. And also we have tools to manage the remote access by vendors to make sure that that's safe and that they're using safe devices and they have agreements. So next Thursday, same time, same place, we are having a demonstration of our software. It's called Partner Risk Manager, and it is at 2 p.m. Amanda is going to actually post in the chat the link so that if you would like to join that and see what we've got to offer, we would love to have you there. And the goals here you can see right on the screen. So you can manage vendor risk through workflow-driven logic, assign risk scores and levels based on vendor attributes and questionnaires, and continually analyze the vendor's performance as it relates to privacy and security. And I'll be giving that one as well. So I would love to have you back and have you hear about what we have to offer. So Amanda, anything since I started talking?
No, we don't have anything else, but like Michelle said, the link is in, it should show up in your questions pane. So feel free to click on that and register, but that's all we have.
Okay, well, thank you so much, everybody. I have my contact information here. I will probably reach out to you on LinkedIn just to connect if we're not already connected, and so appreciate your time. I hope you learned a few things. I would love to hear from you if it was too long to share in this chat or in this session, but if you have some examples or just some tips that you want to share, I would love to incorporate those and share those with your peers. So please reach out to me if I can help you in any way.
All right. And as a reminder, you'll have an opportunity to fill out a short survey to help us continually improve, and that survey will appear when you leave the webinar. For your time, your name will be entered in a drawing to win a $100 Amazon gift card, and our drawings are held at the end of each month. I would like to thank Michelle and also thank everyone who took the time to join us today. I hope you have a great day.
Thanks, Amanda. Thanks, everybody. Bye-bye.